So our presentation is going to be about leukemia and pediatrics.
So, leukemia is a type of cancer that primarily affects the blood in the bone marrow. It is characterized by the overproduction of abnormal white blood cells. Leukemia can be classified into two different types of categories based on their progression. So, it can be acute and chronic. It usually begins in the bone marrow where white blood cells will grow and they'll deviate, but they'll be immature. And these mutations disrupt the normal cell cycle and regulation, leading to uncontrolled filtration of the immature white blood cells, known as blasts. And these abnormal cells crowd out the normal blood cells in the bone marrow. This results in a decreased production of red blood cells, leading to anemia, a reduction in platelets, which can cause an increased risk of infections and increased risk of bleeding out. Signs and symptoms of leukemia can be fatigue and weakness. It can also be bleeding and bruising easily, night sweats, joint pain, enlarged lymph nodes, swollen liver or spleen, unexplained weight loss, and these symptoms often arise from anemia due to the insufficient production of red blood cells. And the abnormal white blood cells often lack the ability to function effectively, which impairs the immune system and increases the risk of infections. Easing, bruising, and bleeding are common signs, and these actually result from the low platelet count that they will experience. So that's why their kids are more prone to bruise, and bleed easily.
Some of the risk factors in leukemia include age, and you're more likely to get leukemia after the age of 60. Gender also plays a role, and men are more likely to get leukemia compared to women. And then your family history and genetic disorders also play a role, because if you have a cousin or sibling or a family member who has leukemia, that can also increase your chances of also having leukemia as well. And your environment is also a contributor, especially whatever exposures that you are exposed to, like radiation and chemicals like benzene, that can also increase your chances of getting this disease. And then smoking is just a really common contributor because it's linked with acute myeloid leukemia. And then for medications, we have radiation and chemotherapy, which are common treatments to target specific cells. And although chemotherapy is a really effective treatment, it can cause side effects such as anemia, infection, and hair loss because it also harms the healthy cells. And that's basically where targeted therapy comes in, because targeted therapy is a type of cancer treatment that basically kills the cancer cells while trying to spare the healthy tissues. And it basically works by targeting the specific abnormalities that can be found within the leukemia cells. And so part of targeted therapy is the tyrosine kinase inhibitors, which basically prevents the growth and survival of the leukemia cells. And then you basically also have BCL2 inhibitors, which are a targeted therapy drugs that block the BCL2 protein. And BCL2 is, it basically prevents cell death. And then you have chemotherapy medications. So you have cytarabine, which is an anti-metabolic that basically blocks DNA synthesis in rapidly dividing cells. And then there's also doxorubicin, which is basically like an antibiotic that interferes with DNA and RNA synthesis. And then there is vincristine, which prevents cell division by disrupting microtubules. And then there's methotrexate, which is folic acid antagonist that blocks the DNA replication. And then etoposide also prevents DNA replication as well.
For labs and diagnostic procedures, bone marrow aspiration is commonly formed. As you may know, leukemia does begin with young and immature blood cells growing in the bone marrow, and it spreads from there. So, since the bone marrow is in the center of some bones, a small amount is usually taken out from a hip bone for the aspiration testing. This procedure can be done under medication to prevent the child from feeling any pain. X-rays of the long bones and chest x-rays are also part of diagnosing, as the chest x-ray looks for any changes such as infection, swollen lymph nodes, or any possibilities that can occur in the chest. For spinal tap is also known as a lumbar puncture, and it checks for cancer cells in the cerebrospinal fluid, which determines if the CNS is involved. And lastly, kidney and liver function studies are performed to determine any normal functioning, which is absolutely necessary for chemotherapy to be safely used in treating the disease. For nursing interventions, maintaining adequate hydration is important to minimize kidney damage. Also, while maintaining your immunizations or shots while being under treatment, you may have to be a bit more careful as your child receiving treatment may have to watch out for immunosuppressive drugs. And it is also important to refer parents to any support groups to help cope with the illness and the stress that the family is going through.
Additional nursing interventions would be providing emotional support to the child and family, encouraging peer contact if appropriate, using an age-appropriate pain scale for pain, and using pharmacological and non-pharmacological interventions to provide around-the-clock pain management. Patient teaching. You want to teach the patient to report any exposures to infections such as chickenpox so that immunoglobulin can be administered. Also, presenting the child's favorite foods can help stimulate appetite. Hair loss is a side effect of chemotherapy, therefore the child can use a hat or wig to help preserve positive body image. School tutoring and counseling should be continuous in the hospital setting and in the home to provide optimal growth and development. You also want to teach the patient to receive immunizations and schedule follow-up appointments, perform infection control procedures at home, monitor for adverse effects of chemotherapy, and perform good infection control practices.
Safety considerations for a pediatric patient with leukemia. The first is to ensure infection prevention by performing hand hygiene. As we know, performing hand hygiene is the number one way to prevent the spread of infection. The patient can also be put on protective isolation precautions. So this includes private room, strict hand hygiene before and after interacting, limiting visitors, especially those who are sick or who've had a recent infection. And then remembering that we shouldn't have any fresh flowers or plants in the patient's room. Routine immunizations for the patient, especially live vaccines, should be delayed as well while receiving immunosuppressive drugs. And examples of live vaccines are MMR and varicella. And then the nurse should also remember to apply lip balm to dry, cracked lips. Complications. So there's 4 priority safety considerations when caring for pediatric patients with leukemia. The first being complications of anemia from decreased red blood cell infection. And then infection from neutropenia, bleeding from decreased platelets, and fractures resulting from the involvement of bone marrow. Thank you for listening to our presentation. These are our references.